I think the key to any weight loss program, of course, is to have good people. We have good surgeons, we have good advanced practice providers, nurse practitioners, physician assistants, who are very dedicated, very passionate about care of morbidly obese patients. But I also think there's an institutional commitment to the program that really differentiates a good program from a great program. And having an institution that's dedicated to all of the ancillary care that we need to provide to the bariatric patients is essential. So our dietitians, our psychologists, our nurses on the floor, our nurses in the operating room, the individuals who help us with upper endoscopies on our patients in addition to the surgeries, in addition to the post-op care. From the top to the bottom, from the beginning to the end, a commitment to the program is essential, and I think we've been able to nurture that here, and we have a very, very successful program. About the last 6 years, I've done almost exclusively robotic surgery, and I do find there to be an advantage to the robotic surgery. And some patients don't quite understand that. I think they get a little bit concerned that I'm going to flip a switch, R2-D2 is going to come out and operate on, and then I'm going to go play golf. But it doesn't work that way. Once they understand that the surgeon controls the robotic arms, I think they're more comfortable with that whole concept. And I believe that the robotic surgery does have a slight advantage over the laparoscopic surgery. They're both minimally invasive. They're both done with very small incisions without getting our big fat hands inside the abdominal cavity. And I think that reduces pain for the patients and reduces the disabilities that they have immediately post-op, something we call an ileus, where the intestines don't work as well right away. All of that shortens post-op recovery considerably. Once you've had weight loss surgery or a weight loss patient, you should probably be seeing us at least once a year. Now, for the first year, during the rapid weight loss phase, I recommend they see us approximately every 3 months, assuming everything's going well. They'll see us at 3 months, 6 months, 9 months, and 12 months after surgery. We'll check things like their weight, of course. We'll check for routine blood tests to make sure kidney function and liver function are good, make sure nutrition is good, make sure vitamin and mineral levels that could potentially be affected by their weight loss surgery are still in good range. And I think that's very important. For the second year, the weight loss is a little less rapid, and we back off to every 6 months, and then once a year thereafter. And I do also recommend that our patients, hey, there are rare surgical complications that come up, there are rare medical complications that come up, and there are definitely some nutritional consequences from the surgery that I think are important for us to monitor. So when I frame it that way and tell them that, hey, after the first 2 years, it's really just one extra appointment a year, they feel a little bit better about that. I do like to also encourage them, hey, you get some abdominal pain, you start having nausea and vomiting, you see a weight change, don't wait a whole year to see us. Give us a call, we'll get you in, and it's better to evaluate you and make sure that there's nothing serious than to ignore a problem for a while. I've certainly realized that for many, many years, patients who suffer from morbid obesity have been subjected to all sorts of discrimination and body shaming and other not so pleasant attitudes by individuals, by society, and even by other physicians. So it's very important, I believe, to be empathetic with their process, with their problem. Many patients, I think, from other physicians occasionally feel as though morbid obesity is their own fault, and many times it's not. So it's very important to be empathetic with the patients, yet really educate them to the risks of being morbidly obese, and then talk to them about some of their options for treatment.